honored to represent the Hickey Family Foundation at Cleveland Clinic Innovation's annual Impact Award presentation. Our founder, Frank Hickey, was a successful entrepreneur who became actively involved in philanthropy 3 decades ago. The foundation was established in 2004, and it was Frank's intention to support activities in 3 specific mission areas that he cared deeply about. They are rescue of youth, focused on helping young people who are at risk to economic, social, and medical issues. Medical training center development projects, supporting medical training centers or clinics. And medical technology development projects, where we work with universities, medical centers, and research institutions like Cleveland Clinic to help pave the way for breakthrough innovations that can improve the lives of patients and methods of treatment. The Hickey Family Foundation and Cleveland Clinic Innovations have a relationship dating back several years to support getting the most promising Cleveland Clinic inventions to the market and to patients. In 2018, we launched the Hickey Innovation Impact Award, in which applications were sought from caregivers working on highly innovative and impactful projects that aligned with our mission to receive a $25,000 award. Please join me in congratulating Dr. Jeff Vince as a recipient of the 2020 Hickey Innovation Impact Award. Dr. Vince is the chair of biomedical engineering within Cleveland Clinic's Lerner Research Institute. His research is working to develop an algorithm that analyzes ultrasound images of carotid arteries to indicate the presence of and severity of plaque buildup. The goal is to predict which patients are at increased risk of stroke to aid the physician in determining the best treatment approach. Dr. Vince received his PhD from the University of Liverpool before coming to Cleveland Clinic in 1992. While he left for a short period of time to work for the Volcano Corporation, Dr. Vince returned to Cleveland Clinic as chair of biomedical engineering in 2011. Dr. Vince is a prolific innovator with 30 invention disclosures over the course of his career at Cleveland Clinic. Though most of these IDFs have focused on his cardiovascular research, his research for this award is in the area of COVID-19 detection and diagnosis. This award goes to support the development of a breathalyzer that will streamline the diagnosis of COVID-19. If successful, this device can also be modified to detect other respiratory illnesses, such as the flu. Jeff, congratulations on your work and recognition with this Impact Award.
Thank you, Nancy. It's a great honor and privilege to be selected by the Hickey Family Foundation. This is something that myself and my team, I have to mention Aaron Fleischman and Feng Lin in this as part of our group that is developing the technology. As you mentioned, this is something that's a little bit out of our wheelhouse. You know, I'm known as an ultrasound cardiovascular person, but I think COVID had such a dramatic effect on everybody, society as a whole, that we felt that we really had to do something that was disruptive and impactful. And as you know, one of the most difficult things when you start something new is getting the funding to make the first step. And, and this is why the Hickey funds will be so crucial in getting this technology off the ground so we can then apply for some of the federal funding which is available for this kind of work.
That's fantastic. Fantastic. So I have a couple of questions. It's so great to see potential for a new, easier diagnostic for COVID-19. Can you please share with us a little more about the breathalyzer project?
Yeah, so this is very exciting. I'm smiling just thinking about the idea. When COVID first hit, I was looking at the technologies that were around for diagnosis, and there's a swab that's stuck into your nose, and then you put it into some gel, and it's sent away for 2 days, and you get a result, and it's very expensive. And I think it's about $200-300 a test. And obviously, if you lived in a disadvantaged community, or you don't have health care, or you live in a country which is not as fortunate as the United States, that is a real detriment to getting the test. So I felt like we had to do something that was quicker, less expensive, and just as good. And I was thinking about technologies that I'd seen in the past, and it seemed like blowing into a tube seemed relatively simple. People do it at the clinic every day. And so that's where the concept of a breathalyzer was born. And I think by using some really innovative design parameters and using materials and looking at different immunocomplexes that we can actually move this technology forward to do a test for under $20 in less than 15 minutes.
Wow, that's fabulous. That's fabulous. You touched on it briefly, but I know that Cleveland Clinic emphasizes the team of teams approach to collaboration. Mm-hmm. So can you share with us a little bit more about the team you're working with to advance this research on this project?
It'll be a pleasure to talk about the team. I think the group we have really embodies the team of team approach. Aaron Fleischman is a brilliant scientist who works on harnessing the breath and detecting the virus. We have Feng Lin from the Immunity and Inflammation Group in the LRI. He's a fabulous person, works with antibodies and reagents and some of the really advanced chemicals that we use in this process. And myself, I have experience in medical device development and technology. I'm actually one of the people I used to live in San Diego, California, and I moved to Cleveland, Ohio. And I think that shows my dedication to the clinic. And I think this is one of the unique places to work in the world. So I think having this environment where we have scientists working alongside physicians to develop innovative technologies. Obviously, none of this would be possible without that pilot funding that we got from the Hickey Family Foundation.
That's fabulous. So the final question I have is, what are your next steps and how will the award get you closer to success?
So we've already started spending the money. We've started ordering the reagents. We have the nanoparticles coming in. We're building the microfluidic chambers. I know this is very technical, but we're looking to have a breathalyzer prototype within 8 weeks from now. There's a very big NIH deadline on January the 5th, where we're going to apply for $3.5 million to develop this technology through into patient testing. But again, without the preliminary data that we got from the Hickey Family Foundation, we would not be able to apply for those funds. We're looking at COVID-19 and flu, but we could also look at TB. We could look at Staph aureus. All we need to do is switch out the antibody that's in the device, and we can
really?
We can test for anything. Yeah.
Oh, that's fabulous. Jeff, I couldn't be more proud to bestow this award to you on behalf of the Hickey Family Foundation. And it's a pleasure to meet you, and I'll look forward to success in your project.
And I will look forward to telling you about our successes. Thank you.